Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you this morning?
I'm great. How are you?
You know what I'm doing. I'm living it up all the time.
That's right. Well, that's an inspiration to me and to our listeners, hopefully, that you could live it up by living pain-free. So if you're having any kind of joint pain, orthopedic pain, muscle pain, tendon pain, ligament pain, back pain, neck pain, hip pain, arthritis pain, carpal tunnel syndrome, stiff joints, dull aches, basically musculoskeletal pain, you want to stay tuned and give us a call right here, right now in the studio at 866-870-5752. That's 866-870-5752, and speak directly with Dr. Darrow about your pain. And when you call the program today, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. And if you want to know what that means, give us a call. Check out the website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on video. We are here Saturdays at 10 and again at 1 p.m. And again, our number right here, right now in the studio is 866-870-5752. What do you think?
I love it. I love it. I love it. And when you guys call in to the studio right now or my office, I will give you a free copy of my book, Stem Cell and Platelet Therapy. I'm handing that up to the video camera right now so I can watch this. And the foreword is by the lovely Suzanne Summers, who I adore. She's a proponent of I'm going to call it the new medicine, not the alternative medicine. Alternative medicine is traditional medicine. That's the new medicine of today using platelets and stem cells. Things are changing. Surgery and medicine used to be the answer, and we are now moving into an age of regenerating the body instead of cutting things out of it. And I've been doing this work now for, 20 plus years. I do it all day. It's what I focus on. It's what I've always focused on. I learned about it during my residency at UCLA. We had a 1-hour lecture on it, and I became a believer at that point because I went to the doctor's office and talked to his patients, and they said, this guy really is God. We've lost the idea of doctors being gods now. But this kind of a treatment of regenerating the body naturally is just amazing. It doesn't work for everybody. I'm not going to say that all surgeries are bad either, but most of the orthopedic surgeries that are done for things like meniscal tears and rotator cuff tears, labral tears, in my opinion, humbly, they should not be done. They don't work half the time. And with regenerative medicine, which is what I do with platelets and stem cells, it's something that's so simple. You just walk into the office, get your injections, and walk out. There's not a lot of side effects to it. So it's simple, it's easy, and I've never heard of someone getting infected from it like we get with surgeries. I've never heard of joints becoming loose like we do with joint replacements. I've never heard of anybody dying like I have seen a couple times in my career when I started out in training for surgery. And I've seen people die on the table. It happens. One terrible story is a 30-year-old woman who came in for an issue, and I was taking her history, and she said that she had had back pain and had had a heart attack. And I was like, how did that happen? I'm going to sneeze.
Bless you.
Thank you.
You're welcome.
And she said I was ready to get a back surgery, and I was given anesthesia, and I had a heart attack from the anesthesia. And I was like, that is crazy. And she said, no, the crazy part was I awakened from the anesthesia, and my back pain was gone. Never had the surgery.
Wow.
So there's a lot of mysterious things in medicine, and we shouldn't jump to surgery to try to fix our musculoskeletal pain, things in the joints, ligaments, tendons. If you have a broken bone, get somebody to get you to the surgeon right away. Get to the emergency room and get a surgeon to put it back together. But most of these surgeries that are done, in my humble opinion, should not be done. Don't get angry with me. I'm allowed to have my opinion from all my years of experience. And the thing that really taught me the lesson was when I was in medical school in my 4th year, I was doing a rotation in orthopedic surgery, and we were in surgery every day. And I loved my boss, my surgeon, my professor, and I asked him to do a surgery on my right shoulder because I was having pain from a weightlifting injury. And what happened? It blew up like a balloon. My arm was full of fluid. I had a high fever. And at that point, I knew I was not going to be a surgeon any longer. And it wasn't for a few years that I found out about regenerative medicine. I injected my own shoulder one night after work during my residency. And I woke up the next morning completely 100% pain-free with full range of that shoulder, that arm that couldn't move. At that point, I knew I was going to do this for a life's work. And it's been a great, great run over the last 20 plus years. And I enjoy doing it. My patients love it because they don't have to have surgery. And it's so simple. We just use platelets from your blood or bone marrow to get the stem cells. And it's easy. It's so easy. Even the stem cells, people go, I've heard that bone marrow aspiration is really painful. If you get a bone marrow aspiration for, let's say, leukemia or something like that, it can be painful because a large amount of blood is aspirated very, very quickly. I don't do it like that, and I don't need a lot of bone marrow to get the stem cells and platelets from the bone marrow. It takes me about 15 seconds. We need a small amount, and then we can inject it. It's very, very simple and very easy. So it's something to consider. If you want to watch videos of me doing these procedures, go to my website, which is www.lastemcells.com. That's lastemcells.com. And on every page you can email me. I get email questions all day and all night long, and I answer all of them. I'd love if you call me up now and talk to me live. We do have someone named Miriam who's waiting to ask some questions about her legs. So Miriam, this is Dr. Marc Darrow. Can you give me your age, please?
Can you hear me?
Oh, yeah, I can hear you well. How old are you, Miriam?
I am 83.
Okay, good. 83 years young.
And I have a great difficulty with walking.
Okay.
Pain in my legs, and when I sit down, it's like the body freezes,
Yeah.
And so I would like to come and see you.
Okay. The phone number to the office, if you want to call right now, is 800-300-9300.
Okay, I am in the car driving, and I've got this on speaker. Can I call back this number and get the number for the office? Are you in the
Absolutely.
LA area, right?
Oh, yeah. We're across the freeway from UCLA on Wilshire Boulevard.
Oh, yeah. Okay. Can I call back and get on this number and get the 800 number when I get home?
Of course you can, but I want to ask you a couple more questions right now.
Okay.
So the pain in your legs, what part of your legs hurts?
Okay, it's like my feet are numb. I don't know if it's neuropathy, and then all the way up to the hip in both legs.
Okay.
And
do you have any back pain?
Miriam?
Back pain. Okay. And what did the doctor tell you about your back pain?
I don't go to the doctor.
Okay.
I had grandparents
I hear you.
who were, they moaned all day and all night and slept all day. We took care of them.
Sure. So, have you ever heard of something called spinal stenosis?
No, I don't think it.
Okay.
It doesn't. The spine doesn't seem to bother me above the hip.
Okay. Well, that's good. I'd have to take a look at you and touch the areas that bother you. Having that type of pain all the way from your hips down, both sides, sounds to me like it's coming from your spine, but I'd have to touch it and see if it's coming from the areas that you're having the pain.
You would know. And they gave me a 6-month-old German Shepherd puppy for Christmas, so we go to the dog park every morning. But the people are so nice. They help me out of the car. They take the dog. They put me on the bench, and then they watch him. Then we're just leaving now. They put him in the car and help me in, and a lot of nice people there. But
wonderful.
No, I really do, because this I'm getting so I can't walk at all.
I wonder if you've ever listened to Warren Eckstein on this channel. He's the pet therapist on the Pet Show.
No,
and he's great.
No. So now I want to call but I don't. I'm driving. I got the speaker phone on.
Okay. If you can remember my name. It's Marc, M-A-R-C, Darrow, D-A-R-R-O-W. You can just Google my name, and you'll find out all the information. I think there's about M-A-R-C, Darrow, D-A-R-R-O-W.
J?
No, D like dog. D like dog, A-R like dog, and then arrow, Darrow. Okay? Miriam, we're going to move on, and thank you so much, and God bless you, and I hope I can help you.
And our number is 866-870-5752, right here in the studio, 866-870-5752. If you're having any kind of musculoskeletal pain, this is the show you want to call right now. Speak directly to Dr. Darrow. And you've been doing this work, the regenerative medicine, for over 21 years, if I counted correctly. Did you know that?
Even more.
Maybe more.
Let me take a couple of questions here, Anita.
Okay.
So the first one I want to take is, it just actually came in at 9:43 this morning. It says, do you think it would work on sciatica? So this is kind of tying into Miriam's question. So if Miriam, I hope you're still listening on the radio while you're driving so you can get more information. So the it is regenerative medicine, meaning using platelets from your blood or stem cells. And does it work on sciatica? That's a great question, because sciatica is not always what we think it is. We think of sciatica as pain down the legs, but often it can be a referral pattern from the ligaments in the spine. And that's very, very, very common. And oftentimes when someone comes in and they say, I've been to several doctors, they did an MRI, it shows I have a herniated disc in my back, and therefore I have sciatica. And I touch their back and I push on it, and when I push on it, it flares down the leg. That typically is not sciatica. Sciatica is a condition where the plexus of nerves from the lower back, which go down the legs, are irritated because they're impinged on. Okay, it can be impingement from a herniated disc. It can be something like facet arthropathy. Those are the joints between the vertebrae that are arthritic. There can be a lot of reasons for it that people have pain down the legs. But very often, if someone has back pain and leg pain, I can get rid of the back pain, and sometimes the leg pain goes away. So it never was sciatica to begin with, although it looked like it was. So Miriam, I'm hoping that's what your issue was, and that we can actually fix it by injections in the low back. In one of my books, which I've written several of, it shows referral patterns from the neck down the arms and from the back down the legs. So be careful that you don't get operated on for sciatica when it really isn't nerves that are being impinged on.
Sounds good. Our number is 866-870-5752. That's 866-870-5752 right here in the studio. And when you call the program today, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And we're here Saturdays at 10, again at 1 p.m. And check out the website at www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. Do you want to talk to Paul?
You bet. I've been chomping at the bit.
I
Paul,
can hear
Dr.
you.
Marc Darrow, how are you?
Paul, are you
Put
there?
another candle on the birthday cake, and I'm now 97 years old. Navy veteran.
You are
World War
not.
II.
Wow.
Are you kidding? God bless you, man. That's amazing.
what-
Good.
Yeah.
So
when I
you've been
stand up,
leaning over when you stand up. Do you have any back pain?
do I have back pain?
Yeah.
Oh yeah, a little bit. Yeah, I can. Not too bad, but if I stood up too long, it kind of bothers me.
Okay. Are you leaning forward or leaning to the side?
No, I'm leaning forward.
Okay. So one thing that happens as we age, Paul, is the discs in our back and spine from the neck all the way down start to dry out. It's called disc desiccation. Sometimes we have what's called degenerative disc disease. In addition to that, as we age, we lose our hormones. And you started losing testosterone probably in your 40s and 50s. And at 97, there's not a whole lot of it left unless you're supplementing it by injecting it or using a cream. So what happens to that is we end up getting osteoporosis. When we have osteoporosis, the vertebrae, in a sense, disintegrate. Okay? That's the bad news about getting older. We can stop the process and reverse it if we catch it young enough by supplementing with hormones. I don't know if that's something you'd ever want to consider, but I'm sure willing to talk to you about it. So you may have some vertebral fractures that are causing you to be bending forward. Okay? And the fact that you have some back pain is something we could probably help you with regenerative medicine using platelets or stem cells, okay? So until I take a look at you and look at an x-ray to see if there's any little fractures, I'm not going to know what to do with you. It sounds like we could inject some of those areas and get rid of the pain you have. I'm not sure we could ever get you standing up straight again, depending on what the architecture is of your vertebrae and discs. So it's something we have to look at. I don't know if you've ever done extension exercises. I do it every single day, a few times a day. I get into a doorway and I put one hand on one side and one hand on the other side in the little V area, and I arch my body forward. Okay, and that's something that you probably should be doing. It's an exercise. If you come in the office, I'll show it to you. If you do want to come into the office...
I used to do those, and I used to supplement my testosterone, but I'm in a healthcare center right now, and I'm going to get out of here pretty soon so I can get back to doing the things I should, okay?
You got it, man. Yeah, I mean, there's a lot of information I have for you. If you want to come in, the phone number to the office is 800-300-9300. You can call now. There's people typically by the phone, or just leave your name and phone number. We'll get right back to you. But I think there's hope for you, Paul. And 97, although it seems old, like when we were kids, 97 was really old. Today, 97's not so old. People are living very long, and I think there's help for you. Okay?
Yeah, I don't think it's old either. I want to get back to weightlifting.
I don't blame you. You know, I had a patient in the office last week, and we were talking about this same kind of thing. And I say, how come you're so young? Your age is, quote, old, but you're so young. And he goes, I've got a very simple answer for you, Mark. I don't let the old man in.
That's good. I also was a runner and ran a lot of miles, so I think that helped too.
Yeah. We got to stay active. Age cannot be considered. We've got to just stay active, and activity is different for different people, but whatever level of activity you're at, keep it up and do more if you can. Always push yourself a little bit.
Okay, well, I'll call you pretty soon now when I get out of here, so thanks for all the information.
Yeah, and my plan today is to exercise after the show. I'm going to go out and play golf. I'm going to go running. I'm going to lift some weights. I'm going to keep my body active. And just like you, Paul, I'm not going to let the old man in.
Right. I played some golf, too, when I was younger.
Well, God bless you, man. It's great to hear from you. I appreciate your phone call.
Thank you, Paul.
Okay.
Bye. Our number is 866-870-5752. That's 866-870-5752 right here in the studio. You can talk directly to Dr. Darrow. I have lines open for you right now. The website is www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. How about that?
Yes, I love it.
And if you're just tuning in and you wonder what we're talking about, this is a show about orthopedic pain or musculoskeletal pain. So if you have joint pain, tendon pain, disc pain, back pain, neck pain, hip pain, arthritis pain, etc., then this is the show for you. And again, lines are open right now for you to call 866-870-5752.
So, Anita, what the show is really about
is
taking the surgery out of pain. I want people to know that. What we do is we hopefully can alleviate the need to have surgery. Okay? So I get people that come into the office every day and they've been told by orthopedic surgeons, who I love, by the way. I'm not putting down surgeons. It's just they're doing too many surgeries that, in my opinion, shouldn't be done. And the techniques we do help people avoid surgery, and that's what the show is about. That's what my life is about, avoiding surgery. I had a shoulder surgery. It failed. I get way too many people in the office who have failed surgeries. There are diagnostic codes with insurance companies that say failed back syndrome. That means too many people are getting operated on, and it doesn't work. Let's go to Maria in Santa Monica. Maria, you've got low back pain. How are you today?
I'm good. Thank you for taking my call.
Yeah. Ask me some questions. I'm ready.
Okay. Well, I'm actually calling on behalf of my mom. She's 78, and she's had one back surgery. But since that back surgery, she has burning, stinging, freezing feeling that's just out of control, and it runs down the length of her legs. And she's also had both hips replaced. And we're trying to avoid another surgery, although, it just doesn't look good right now. But anyway, it's just unbearable. At one point, she thought that the issue was there's a syndrome that men get when they wear a belt that's too tight that might have been causing it.
That's called, it's the lateral femoral cutaneous nerve that gets impinged on. And it happens with people who are overweight, and they have pannus, which is extra fat that hangs over their tummy, and it crimps that nerve. That's very common. Or in people that wear really tight pants or tight belt.
Well, she doesn't fit either of those categories. But
but that's commonly what happens. Yeah, but it could be the L3-4 nerve that was impinged on during surgery that does that too. Or it could be lower down also. Sometimes, I shouldn't say sometimes, almost always in surgery there's some scarring from the bleeding that takes place. And that can cause this type of a syndrome. She may also have something called arachnoiditis, where the arachnoid tissue around the spinal cord is inflamed. There's a lot of possibilities of what's going on with your poor mom. And hang with us till after the break, and we'll get back to you and your mom.
Stay tuned, everybody. You're listening to Living Pain Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information coming up. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.